Certainly I've heard people anecdotally talk about how they feel like they are recovering better when they're using essential amino acids, generally elderly patients. So I think there may be something to that. All right, and then essential amino acids, I suppose we can go ahead and pull up this study looking at how essential amino acids affect potentially recovery from exercise. So this study looked at essential amino acid supplementation and was looking at the maximal voluntary contraction that could be achieved after performing some exercise. And here you see this gentleman in this sort of apparatus to test how strongly he's able to contract the muscles. And if we scroll down to the results of the page, we see that essentially the take home is that this essential amino acid mixture increased the amount of contraction someone is able to apply even when they are fatigued. So someone might be able to perform more exercise volume or go back and train again sooner, which, listening to some of Andy Galpin's work that has really come out of the mainstream recently, it seems like the more frequently you're able to train and then subsequently recover from that, then the greater potential for adaptations and muscular hypertrophy and sports performance, whatever your goal is going to come more quickly the more frequently you can train and recover.
Sounds like a very reasonable addition.
But in terms of stimulating protein synthesis, this isn't something that has been particularly well studied with the essential amino acids. There was a study that claimed that the consumption of essential amino acids is, well established. It's been well validated that this is going to increase muscle protein synthesis, kind of as a blanket statement. But when you go into these papers, and I think this was a systematic review, and you actually look at the citations, in this case, both of those citations were done in geriatric populations, one of which consisted only of heart failure patients. So you can't necessarily generalize that to what may happen in a healthy individual. But to me, this kind of signals that maybe the elderly population would get a beneficial effect from some essential amino acids. Typically, they do have lower protein intake at baseline. So the question is kind of, do the EAAs themselves have an anabolic effect if protein intake is where it should be for optimal recovery and protein synthesis? Is it something unique that it does in the older population? And certainly I've heard people anecdotally talk about how they feel like they are recovering better when they're using essential amino acids, generally elderly patients. So I think there may be something to that. What are your thoughts?
I do think there's a lot of merit to the practice of utilizing EAAs. This in general is a good example of selection bias and how it can be a positive or a negative thing. So there's a reason why they selected that group of individuals is they hypothesized it, and we hypothesized that an older age group will derive more benefit from something like EAA. So looking at them and then being able to apply that to your own protocol, whether you would fall into that group or not, can help you say, yes, this is worth it to add in, or this is not worth it to add in. Otherwise, you can kind of get on this domino effect of wanting to incorporate every supplement and medication that is considered beneficial. And before long, you're taking 2 or 3 dozen different pills every day.
Yeah, and there's a lot of, I guess, resources or financial resources that are devoted to that. So if someone is using these EAAs, but they could simply add 50 grams of high quality protein to their diet, then that's going to blow the essential amino acids out of the water in terms of the health effects of that. In terms of the bang for their buck, it's going to be much more cost effective to add the protein in versus the essential amino acids for the output that you're going to get from that.
Another good example of food is medicine. Again, let us know in the comments. We'd like it when people debate whether or not food is medicine. We believe that it is.